Diabetic foot.
Good day, sir. My name is Dr. Fatih. I'll be your doctor today. What is your name?
My name is Alexander Liponovich.
What are your complaints? Why are you here?
About 2 months ago, I hit my toe and there was a wound with bleeding, and I tried to treat it by myself, but till now it hasn't healed.
Did you visit a doctor?
No, I didn't.
Okay. So do you feel any pain?
No.
Any difficulties during when you walk?
Yes.
Do you have fever or chills?
Yes. My fever started about 5 days ago, and since then the wound has increased in size.
So do you have any general weakness?
Yes.
Okay. So I'm going to ask you some questions about your past health history.
Okay.
So have you ever had gastric ulcer?
No.
No. Okay. Any allergies?
None.
No allergies. Have you ever done blood transfusion?
No, I haven't.
Do you smoke?
Occasionally.
Okay. Alcohol and drug abuse?
Never.
Has any of your family members ever had diabetes?
Yes.
Do you have diabetes?
Yes, I do.
For how long have you had diabetes?
I had it for about 34 years now.
Have you seen a doctor for this?
Yes, but generally I maintain it by myself.
Have you ever undergone any operations?
Yes, about 10 years ago I had appendicitis, so it had to be taken out.
Have you ever had tuberculosis?
No.
Stroke?
No.
Myocardial infarction? Arterial hypertension?
No.
Bronchial asthma? What medications were you using when you were self-medicating for diabetes?
Just insulin.
Okay, so can I take a look at your food?
Okay.
During the local extremity examination, we can see that the localization of the injury is in the left foot. The collar has a hyperemia on the dorsal part and cyanosis in the fifth toe. There is also a pulse presence normal. The pulse volume is also normal. Local leg temperature is also normal. Numbness is present. Regional sensitivity is low. Paralysis is absent. Capillary refilling time is about 1 second. Regional blood pressure is 120 per 80. Muscle wasting is absent and traffic ulcer is present. In the examination of the ulcer, we can see that it is healing by secondary intention, is in inflammatory stage, has a size of 1 to 2 centimeters, no discharge, so it's a dry wound, has a circular shape, the color is bluish black, has smell, and is present local heat. During objective examination, all systems were without any dysfunction and the condition of the patient was satisfactory with Glasgow Coma Scale 15 points.
Okay, so from our diagnosis, you have an injury in your fifth toe, which is at inflammatory stage with presence of infections. So right now, a surgical treatment with amputation will be needed.
Amputation?
Yes.
Is there any other way? Or?
No, because without surgery, it's doubtful. But with surgery, your chances are 99% to almost successful.
Okay.
So do you agree to surgery?
Yes.
Alright. So we have a consent form you have to fill here. So you have to sign here.
Can I read it?
Yes, you can. Okay, so before surgery, we're going to take some additional lab tests, like a blood test for your neutrophil count for inflammation. Then a urine test will be done for the concentration of glucose in your urine. We'll take a glucose test also to see if your diabetes is compensated, to see how much it has affected your injury.
Okay.
An X-ray test of your foot has to be done to see how your bone has been affected in any way. And a swab of X-ray from the injury will be taken to see any presence of bacteria. And an ECG test will also be done to check for any further heart complications.
Okay.
Okay.
How long would I be here after the surgery?
You will be with us for about 2 weeks for general monitoring of the injury.
Okay. What's the procedure going to be like in general?
So we'll be amputating your fifth toe, like I said, where we excise the dead tissue around your foot.
Okay. And how long would the surgery last?
About 30 minutes to an hour.
Okay. Would I feel any pain during the surgery?
Oh no, you'll be given a regional anesthesia at your spine for general numbness.
Okay. So what happens after the surgery though?
After surgery, your legs will have to be elevated, and then you have to not engage in any physical activities like swimming until at least the injury is healed. And then you have to be on a low sugar diet to control and decrease your dietary sugar intake, so it doesn't complicate or worsen your diabetes. And you also be on a dyslipidemia management to monitor and control your cholesterol and body fat percentage. And you also have to stop smoking.
Okay.
And for your medical therapy, you'll be given some painkillers and some antiplatelet drugs like aspirin, 160 milligrams, which you take once a day, every day.
Okay. Thank you, doctor.
Okay.
As part of the medical treatment, elevated legs, low sugar diet, dyslipidemia management, medical therapy targeted at symptoms, antiplatelet drugs such as aspirin, and painkillers are recommended to the patient. Due to the requirement of surgery in this case, the surgery treatment plan will be: first, prepping, draping, and aseptic techniques. After, general anesthesia. Then, we'll make an incision, an intentional wound, and wound irrigation. After will be the control of the bleeding, debridement of the wound, and at last, we won't suture because this injury will be healed by secondary intention.